13th National Two Shows Council Conference continues at the Artichon Conference Center. Two shows treated to a high-level reception at State House and Public Health Minister elected Vice Chair of WHO Executive Board. Hello, welcome to InfoHub. It's Tuesday, October 8th. We have lots to tell you. On Monday evening, His Excellency President David Granger hosted a cocktail reception for Two Shows and other Indigenous leaders attending the 13th National Two Shows Council Conference.
The Indigenous leaders were treated to an evening of drinks, food, and steel pan music at the Baridi Benab State House. During his welcome remarks, the President reminded of the administration's focus of the development of the human capital, especially women and children, and generally improving the quality of life of communities in the hinterland region.
We want to ensure that all Chinese see themselves as equal, and it is impossible to achieve equality without the contribution of first peoples, the indigenous people of this country.
The two shows are in Georgetown for the 13th Annual National Two Shows Council NTC Conference being held at the Artichon Conference Center. The 5-day conference allows village leaders to have engagements with the President, government ministers, and officials from various government agencies. For InfoHub, Delicia Haynes.
Public Health Minister, the Honorable Valda Lawrence, was elected to serve as Vice Chair of the Global World Health Organization's Executive Board during the 71st session of the Regional Committee. This came as Minister Lawrence headed Ghana's delegation to the 57th Directing Council of the Pan American Health Organization meetings Regional Committee of the World Health Organization for the Americas. The high-level meeting was held in Washington, D.C., USA from September 30 to October 4. Whilst in Washington, Minister Lawrence gave a presentation on multi-sector collaboration to prevent and respond to gender-based violence in Guyana. During her presentation, she also highlighted Guyana's efforts to implement several measures, including the Spotlight Initiative, which targets women and girls affected by gender-based violence to help improve their overall health and well-being. The board on which the minister has been nominated to serve plays a significant role in meetings at the World Health Assembly, the WHA. The board usually gives effect to the decisions and policy of the Health Assembly, advises it, and generally facilitates its work. In its commitment to providing safe drugs, the Ministry of Public Health has begun consultations on strengthening its regulatory systems.
The Ministry of Public Health is ramping up its effort to ensure the health and safety of the Guyanese population. It is not only ensuring that supply is there to meet the demand, but that the outsourced pharmaceutical drugs are safe for Guyanese. A workshop is currently being conducted with the aim of strengthening the procurement system. Technical Assistant to the Ministry of Public Health, Patrice Douglas, explained that the exercise is essential as 1 in 10 drugs sold globally is substandard.
The World Health Organization has suggested that in order to prevent, detect, and respond to threats associated with substandard and falsified medication, we must increase technical capacity. The ministry will continue to ensure that all areas that best practices and good governance is done in the public health sector.
Further explaining some of the risks that are involved in procuring unregistered medication, Director of the Food and Drug Department, Marlon Cole, pointed to recent reports which stated that 7 persons in Trinidad had lost their sight due to the use of a substandard drug.
To date, we haven't had such cases as yet, and we're thankful that we haven't had any, but you can understand the importance in terms of the support, technical capacity, the type of resources that would have been channeled by PAHO, by the Ministry of Public Health, to help us strengthen our regulatory capacity is to ensure that these occurrences does not take place in our society.
The Ministry of Public Health has taken several steps over the past 4 years to ensure that safe drugs are brought to Guyana. This includes becoming the first country in the Caribbean to get registered to the Caribbean regulatory system. This will mean that all drugs procured are reviewed and monitored for efficacy, safety, and quality. Isaiah Braffett for InfoHub.
PAHO WHO in Guyana is working with stakeholders from the health, forestry, and agriculture sectors to structure a system and build capacity to protect the local population against yellow fever.
According to the World Health Organization, yellow fever is an acute viral hemorrhagic disease transmitted by infected mosquitoes. The yellow in the name refers to the jaundice that affects some patients. Vaccination is the most important means of preventing yellow fever. In Guyana, there is an excellent yellow fever defense. PAHO WHO representative Dr. William Adukro has indicated that though there is a 95% vaccination coverage, intense surveillance is paramount to ensuring the Guyanese population is safeguarded against yellow fever.
In 2019, 3 countries in the region of the Americas, Bolivia, Brazil, and Peru, reported confirmed yellow fever cases occurring between December 2018 and February 2019. In 2018, there were 5 countries and territories in the region of the Americas that reported confirmed cases of yellow fever: Bolivia, Brazil, Colombia, French Guyana, and Peru. Ladies and gentlemen, Guyana has been free of yellow fever since 1968. Let it be said many years to come that we here were party to making sure that it stayed the same.
Dr. Adukro was speaking from a public health perspective during a workshop on Tuesday. It was explained that research conducted has shown that despite intense vaccination efforts in endemic areas, sporadic cases and outbreaks continue. This is due to a jungle cycle of transmission which is mostly predominant in the Americas. Deputy Chief Executive Officer of the Guyana Livestock and Development Authority, Dr. Dwight Walrond, explained that this is where efforts of the GLDA, along with the Public Health Ministry's Veterinary Department, is important.
A lot of foreign exchange that is earned by Guyana is earned through the wildlife trade. So our staff on a daily basis would interact with these primates. In addition to that, there are other animals which they are exposed to. And you might want to ask the question, how do we deal with this? How do we know when to test for X disease? What samples should be taken? Unfortunately, that is determined by the importing country.
A 4-day workshop is currently being held at Carolodge to engage stakeholders who will be exposed to protocols and experiences from Brazil, which will result in an integrated surveillance structure. For InfoHub, Delicia Haynes.
The Guyana Geology and Mines Commission has been instructed to begin investigations on the matter regarding the death of Ryan Taylor, a young miner. Taylor died this morning in a mining pit which collapsed at Troy Resources in Karuni, Region 7's operation. The Minister of Natural Resources, the Honorable Raphael Trotman, has instructed that investigations begin and also asked for a report to be compiled and submitted. In the interim, all work in the area of construction has been ceased pending the investigation. The Ministry of Natural Resources offers sincerest condolences to the relatives and friends of Ryan Taylor. The Agriculture Ministry rolls out its Grain H initiative and $8 million upgrade for the Alboyston market. Details of these after the break.
Are you ready to embark on a truly epic adventure to an undiscovered corner of South America, where some of the most spectacular natural attractions are unveiled within a beautifully diverse landscape? From the wetlands and savannas to the ancient mountains, magnificent waterways and lush enriching rainforest would provide a vast playground for some of the most exotic and breathtaking creatures on the planet, including many of the world's giant species. This untouched land of mystery and wonder serves up an exclusive experience for travelers. So are you ready for a new, awe-inspiring adventure? Welcome back to nature. Welcome to Guyana.
Thanks for staying with us. The Ministry of Agriculture, through its recently launched Guyana Realigning Agriculture for Improving Nutrition and Health, or Grain H program, has begun the effort to promote healthy living at several facilities across Region 4.
Close to 100 patients attending clinic at the Guyana Cancer Institute received medical plans on Tuesday. The initiative is part of the ministry's Grain Age program and is in observance of Agriculture as well as Cancer Awareness Month. Deputy Chief Executive Officer of the Georgetown Public Hospital Corporation, Elizabeth Gonzalez, described the move by the Agriculture Ministry as very unique.
So I want to encourage all of you today, as you go through whatever you go through, just remember good nutrition. And let's remember that plants and vegetables were intended to be the original food for man.
The patients were encouraged to adopt the habit of planting their own kitchen gardens. As Minister within the Ministry of Agriculture with responsibility for rural affairs, the Honorable Valerie Adams Yearwood emphasized the importance of consuming healthy foods.
We are, from the Ministry of Agriculture, helping you as we help ourselves to realign our nutrition, realign the food we eat and the way we eat food.
InfoHub spoke with one of the recipients who described the initiative by the Agri-Ministry as an excellent step and suggested that this be done annually.
I feel that was good for the first time that we ever have that, and I think they should promote more every year for the patients and you come and encourage the cancer patient more to do better for themselves.
On Monday, health centers within the Demerara Mahaika area benefited from tools to boost their kitchen gardens. The health outpost also received forks, spades, hoes, pickaxes, and cutlasses. The Grain Age initiative was established by the Agriculture and Public Health Ministries. The aims of the initiative are to ensure Guyanese have access to sufficient, safe, and nutritious foods, and more importantly, that we practice a healthy lifestyle. Kellen Rover for InfoHub.
A newly constructed revenue office and the renovated city constabulary outpost are among the expected upgrades for the Old Boyston market. These upgrades total more than $8 million. Today, a team from the Georgetown municipality visited the market to assess the works.
With the amenities added, rehabilitative works are 95% complete. InfoHub spoke with constituency councillor for All Boyston Charlestown, David Allicock, who expressed his satisfaction with works done thus far.
We're doing over, as you can see here, the office. We're doing the roofing. You have new clapboards roof. You have fixed ventilation and a brand new step. There's also a sanitary block.
The construction, which commenced 6 months ago, has been divided into 2 phases. Currently, works in Phase 1 are expected to wrap up by next week. Measures are already in place to roll out Phase 2 rehabilitation works at the market, according to Councillor Heston Boswick, also of Constituency 10.
Well, Phase 2 will definitely cause a significant sum since we recognize that it's partly 90% to the roof will have to be done, because not so long ago there was some attention given to the fish pond area, and that's the western side of the market. So you will find that it's mostly the northern, eastern and southern side that really needs total resheeting of the roof.
Funds were allotted to carry out major rehabilitation works at other markets in Georgetown after a tendering process by the Georgetown Mayor and City Council. For InfoHub, Ayana George.
More youths are qualifying themselves in various fields through the Board of Industrial Training. On Friday last, BIT certified another 206 youths who are in high spirits as they see their futures being much brighter.
Michael Allison, whose favorite dish to prepare is pasta in creamy Alfredo sauce, was the only male that entered and was successful in the culinary arts course. He strives to be a role model for his younger daughter.
Well, yesterday was her birthday, and I baked a cake for her. I iced it and everything, and she was there. So she would like to do just like her dad.
The heavy-duty machinery operating program also had a large number of rising stars. Gregory enjoyed the flexibility of the program.
I'm a working man, and the course was actually free. Right, it's the USAID and the board came together and offered us a course that's free of charge, which we know this course these days are kind of expensive. So it was a great opportunity for me, being a working man, just a little sacrifice, because the classes was after work actually for 4 hours. So for 6 months from Monday to Friday, that's what we put in. We know the big oil coming together now. It's only right for us to take these opportunities from the government, get ourselves in gear, so in order for us to get a bright future for us and our family.
The lone female in the same heavy-duty machinery program hopes to set a high bar for her little daughter.
I hope that she will become better than her mother and more empowered than her mother.
What do you hope to do moving forward now that you have this certificate?
Well, to become a professional operator and to move forward in life.
Chairman of BIT, Clinton Williams, said the training institute plans to improve youth training in remote sections of the country. BIT has generated over 20,660 artisans and semi-skilled workers that have been added to the workforce, and it is estimated by the end of 2019, a total of 25,000 persons will be trained in various skills. Shaquille Bourne, for InfoHub.
That's all for today. Connect with us on WhatsApp, Facebook, and YouTube. Much more news is on our website, dpi.gov.gy, and pop over to Instagram for the latest photo updates at DPI Guyana. Your bridge and weather reports are up next. Goodbye for now.